Welcome to Breaking Ties, Destination Divorce. This is your go-to source for practical advice and support while you go through the divorce process. Join us each weekday for a quick chat where we'll cover a variety of topics such as child custody, property division, and self-care. Together, we'll explore emotional, financial, and legal aspects of divorce and help you find the best path forward for you and your family. Here's your host and Certified Divorce Financial Analyst professional, Mike Fulkerson.
Hi, and welcome back to Breaking Ties, Destination Divorce, the podcast that provides insights and guidance on navigating the complexities of the divorce process. I'm your host, Mike Fulkerson, financial advisor and certified divorce financial analyst professional. And today, we're addressing a common concern among divorcing parents. Who pays for health insurance for the children after the divorce? It's a critical aspect of post-divorce financial planning, so let's take a look. When it comes to the responsibility of paying for health insurance after a divorce, it's often outlined in the divorce decree or settlement agreement. The legal responsibilities can vary based on jurisdiction and the specific terms agreed upon during the divorce proceedings. In many cases, one parent may be designated as the custodial parent, and as part of their financial responsibilities, they may be required to provide health insurance coverage for the children. However, this isn't a one-size-fits-all scenario, and it's essential to carefully review the terms of your individual divorce agreement. It's not uncommon for divorce agreements to include provisions for shared costs and contributions towards health insurance. In such cases, both parents may be responsible for covering a portion of the health insurance premiums and any out-of-pocket expenses for the children's medical care. This shared approach is designed to ensure that the financial burden doesn't fall entirely on one parent, fostering a more equitable distribution of the costs associated with the children's healthcare needs. The source of the health insurance can also impact who pays for it. If one parent has access to employer-sponsored health insurance that is cost-effective and provides comprehensive coverage for the children, the divorce agreement may specify that this plan should be utilized. However, it's important to consider the practicality of this arrangement, especially if the non-custodial parent doesn't have easy access to the same employer-sponsored plan. In such cases, alternative arrangements may be negotiated to ensure the children's health care needs are adequately met. Life is dynamic and circumstances can change. It's essential to recognize that the initial divorce agreement may need to be revisited if there are significant shifts in either parent's financial situation or if there are changes in available health insurance options. Open communication between co-parents is crucial in these situations. If modifications are necessary, it's advisable to consult with legal professionals to ensure that any changes to the health insurance arrangements are formalized and legally binding. As we wrap up today's episode, it's clear that the question of who pays for health insurance for children after a divorce requires careful consideration and adherence to the terms outlined in the divorce agreement. Remember, the goal is to prioritize the well-being of the children and ensure that their health needs are met. Thank you for joining us on Breaking Ties, Destination Divorce. Should you have any questions on this topic or other financial planning issues, feel free to contact me. My information is in the description. Divorce is not the end of your story. It is the start of your next great chapter. All the best.
We want to thank you for listening to this episode of Breaking Ties, Destination Divorce with Mike Fulkerson. For questions, please reach out to Mike via email in the description or give him a shout at 630-444-1410. Remember to subscribe, like, and follow.